Good morning, Rashad. Thank you for coming in here to tell us a little bit about yourself. And why don't you first introduce yourself and just tell us who you are?
My name's Rashad Massoud. I'm the Senior Vice President for University Research Company's Quality and Performance Institute. And in this capacity, I direct the USAID Healthcare Improvement Project and the newly awarded USAID project that's called the Assist Applying Science to Strengthen and Improve Systems.
Okay. Well, can you tell us, in that capacity in those projects, how is it that you apply health workforce development approaches to improve quality of care? What does that mean?
What we basically do is we look at how we engage the health workforce by working with the workers themselves in order to improve the productivity of their work, the performance overall, engaging them in the work process, and ultimately trying to improve the retention of the health workforce.
And you link that to health outcomes specifically?
Yes. So as we do this, what we basically do is we look at the outcomes of interest, and we redesign processes of care in order to do that, fully incorporating factors that affect human beings as they perform in these systems.
Oh, that's interesting. Well, let me ask you this. What are some key elements that make your approach unique?
Basically, what's happening here is that we're working at the service delivery level. Basically, where the patients receive the care, that's the key point. And as we do that, we're working with the health workers themselves. These are the people who have a lot of insight into their systems. They can understand the gaps, they can develop solutions to fill these gaps. And by doing that, what they're really doing is they are essentially owning the changes they're making. They are empowered to make those changes, and that contributes in a huge way to the sustainability of the results that we get.
Oh, that's great. And it seems to me that through this project, you're actually expanding the scientific understanding of this approach and feeding the global knowledge on human resources.
Exactly. What we're looking at here is the following. We need to understand what makes people do what they do. How do we motivate people to do the good work that they're doing and they're capable of doing? We need to understand what are the factors that stimulate or, on the other hand, stop people from performing in these ways. And what we have a global remit as a project to study these effects and contribute to the global learning on how do we motivate the health workforce. So in this regards, we're really asking the questions that pertain to how do we get people to do the good work that they're doing, how do we enhance these, how do we make this a process that is sustainable going forward.
So would you say your focus is looking at how you assess engagement and how you measure performance and how productivity and performance relate to each other?
In order to do that, we definitely need to understand how to measure performance. We also need to understand where the intersection between how productive somebody can be versus the quality of the work that they produce. So these are, major questions that need to be studied, and we're at the forefront of these studies. As you can see, some of the work that we've done with these health workers has really fed into national policies ultimately. In Niger, for example, the work that we engaged with our counterparts in has evolved into national policies on how to develop the health workforce. We're now taking this work into other countries, Tanzania, Uganda, Ethiopia, Burundi, and really we're on the increase in this respect. So we're hoping that not only can we produce local improvements, but take those improvements to many other countries and have a much wider global effect, as well as learn about this as we're doing it.
I think that you've given us quite an insight, and we appreciate your time today, Rashad. Thank you.
Thank you.